So, recommendations for practice. The researchers concluded that the proper chest physiotherapy before and after abdominal surgery definitely reduces the frequency and severity of post-operative chest complications. So, either using an incentive spirometer or doing breathing exercises like diaphragmatic breathing exercises before and after abdominal surgery decrease the chances of developing a pulmonary complication. So, a source recommends that such exercises are performed every 1 or 2 hours, but there's no consensus on the optimal frequency. So, more research would need to be done to determine how many times these exercises would need to be done to be most effective. So, right now, the floor recommends at least once every waking hour. From all the articles researched, there is a need to enhance the correct use of incentive spirometer for abdominal surgery patients and the correct teaching of diaphragmatic breathing by the assigned nurse. So teaching can always be done. There's no such thing as too much teaching. So for the incentive spirometer, you would want to teach the patient to place the mouthpiece in your mouth and then seal their lips around it. Breathe in slowly and as deeply as possible. So you should notice on the side there's this yellow piston rising toward the top of the column. And then the yellow indicator should reach the middle of the two, and it should be marked. So you hold your breath as long as possible, at least 5 seconds, then exhale slowly and allow the piston to fall to the bottom of the column. And then you want to rest for a few seconds to prevent yourself from being winded. And then you want to repeat this at least 10 times every waking hour. And then ideally you should mark your best height on how much in L you can do, so you can mark your progress as you do this. And after you do each set of 10 deep breaths, you want to cough to make sure that your lungs are clear. And if you have an incision, like an abdominal incision, you should support the incision when coughing by placing a pillow firmly against it.